Hi there, I'm Dr. Helen Sue from Hella Mental Health, and I want to address a frequently asked question about medications for anxiety disorders. So anxiety disorders are one of the top reasons now that I see clients, and they can run a whole range. There are a spectrum of disorders, from generalized anxiety disorders to specific phobias to obsessive compulsive disorders, etc., and panic disorders. So they're really, really impactful disorders. They're not just like, oh, I think a lot, I have an obsession with cleanliness, or I just stress too much and I need to de-stress. Anxiety disorders are very physically draining. They take up a lot of mental energy and space. They can be really, really debilitating and intrusive. But one of the important questions I get is from people who are really afraid to consult with a psychiatrist and consider medication. Now, meds aren't for everybody, but I do want to address some of the fears. So, like, one person asked recently, as soon as I get on meds, that means I'm going to be addicted to these and I have to take them for the rest of my life, right? So I don't want to do it. And that's not really true. I would say the vast majority of my clients who trial medication for their anxiety, some decide this isn't for me. Many decide this is so helpful and I wish I'd done it sooner. But also, most of my clients do eventually gain more skills to manage their anxiety and taper off and eventually take smaller amounts or just get off meds entirely. The metaphor I often give is that when you are just awash in the physical agitation of anxiety, the ruminating thoughts taking up all this space, making all this noise, the meds might turn down the volume and the intensity of the symptoms, give you a little relief so that you can actually focus your time and attention on learning the skills, the cognitive skills, the physical grounding skills, to actually modulate your anxiety on your own so that you can eventually taper off the meds and do without. So that's my take on thinking about medication evaluation as a possible way to address your anxiety spectrum disorder. The research does show that a combination of therapy plus medication is the fastest way to relief. So make sure to ask your MD, your therapist, about where your symptoms are and whether a med eval would be a good idea for you. And don't be afraid to give feedback if you do have one about, maybe this med has too many side effects, or I've tried this and it's not for me. You should say so, because there are different medications and your doctor needs to know how to titrate your dosage or try different med, that your experience is unique to you. But I don't want you to be afraid to explore all your treatment options to relieve yourself from anxiety disorders. So if you have more questions about mental health, definitely drop them in the chat and hopefully we'll address them in a future video.